Good afternoon. We're just letting everyone in, so just hang on real quick. Well, thank you for coming and spending your few minutes of your lunchtime with us today. You know, as it seems odd in August, right? We're still in August to be talking about advocacy and our county legislative meetings. For those of you who are involved at all with some of the legislative issues, I feel like we just finished committee weeks and session. I know it went long this year, but we are already, as an association, have already been hearing from you as members some of the issues that we might be able to work on this year. We have two or three things that we've already have on a list to talk with ACA about to see if they can do it through rules or even whether that will, I'm sorry, do their own rulemaking or whether we need to actually have some statutes or, whatever we need to have done for the session. So we are already working on that, but because we're trying to help prepare for this next session, upcoming session, which is in January, the county delegation meetings are already starting. So we wanted to invite you and have Kyle be able to kind of talk through how you might be able to prepare better for those meetings. And so I'm going to turn it over to Kyle.
Good afternoon, everybody. Thank you, Denise. So before I go into the county legislative delegation meetings, just to piggyback off of what Denise mentioned, so the session, 60 days every year. Next session will begin in January, and that's 60 days and run through March. This year it was March through May, so that goes back and forth every other year. Prior to session, though, the first thing that takes place are these committee meetings, county legislative delegation meetings, take place in every county across the state. And then after that, there's 6 or 7 weeks this year, 7 weeks, I believe 7 weeks of committee meetings that take place in Tallahassee even before the legislature convenes in January or in March, depending on the year. So there's a lot of activity that's about to kick off. These legislative delegation meetings are already started, as Denise mentioned, and then the committee meetings that take place in Tallahassee will begin the first week of October. So things are certainly rolling, but today to talk to you about an opportunity to advocate well before session and in your community. These county legislative delegation meetings are, like I said, annual public forums hosted by state lawmakers, and they consist in every county of every state senator and every state representative serving in the Senate and the House who represent that county. And they all come together to hear from residents, stakeholders, as well as local government to find out what asks they have to bring back to Tallahassee when when session convenes. So they'll be talking about local government needing state funding, local institutions, educational organizations seeking state funding, but also hearing from residents and stakeholders about concerns and priorities at the state level. So this is an opportunity for home care professionals to go and talk about anything that is related to home health licensure, background screening, especially Medicaid issues will be a hot topic that we're hoping you'll bring to your lawmakers, and issues like workforce, sustainability and growth that we are deeply challenged by. So again, this will shape the 2026 legislative session that is set to begin on Tuesday, January 13th and run for 60 days. If you're not aware of our annual Home Care Day at the Capitol, that's our annual Advocacy Day. That will take place probably closer to the end of January. That's still not finalized. We will get that date to you, but if you can tentatively save a date in late January for that, it'll be also an opportunity to meet with legislators in person when they're in the throes of the legislative session. So why these meetings matter for home care? So lawmakers are listening, but only to the voices in the room. Denise actually went to a legislative delegation meeting this before this past session in Pasco County, and there are so many folks in the room from so many different sectors, home care being just one of them. So they're hearing from educators, they're hearing from transportation officials, again, local government. There's a variety, a plethora. Of stakeholders who are going and meeting before or speaking before the legislative delegation. And it's such a unique and local convenient opportunity for you to go and speak for just a few minutes about the critical issues facing the home care sector. Denise, would you like to talk just a little bit about your experience?
Yeah, and I think to that point of the variety of people who do come to speak, I think it also helped me in knowledge about that county. I'm just saying, I went to a local county meeting, and it honestly helped me to see some of the issues that existed in the county. And as Kyle said, that variety can be anything from last year it really seemed to be a lot about preparation for the hurricane season, and but it was about road work. It was anyway. It was just it was even centering around some mental health issues related to long-term care, and so I'm just saying there were a lot of different voices. But it did give me an opportunity to talk to them about some of the concerns that we had going into last session. And even to the point where I was kind of towards the end of speaking that day, that I did have a couple of people within the audience even, and a couple of the representatives, asked me questions after, and, that they wanted to be involved, and was there anything they could do if I could come and see them. I'm just saying they also followed up. It was something that was also pertinent to them, and or it was something they were interested in. So maybe that's why they reached out to get more information. But I did feel like I networked in the room, honestly, with other people who were part of even, I remember I talked with some ALF folks who were also concerned about care being provided by agencies that the client had managed care contract, and they all of a sudden stopped coming, and they couldn't figure out why. And I think it's probably because they didn't get authorization, and if that's your same problem, which I've seen on the forum this week, is having authorization and not being paid, etc. This would be a great opportunity once again to be a voice. But it was interesting to hear all of the other things. And I have to tell you, here's the thing. I honestly had to get talking points from Kyle. I needed to make sure that I stayed on task. And I did use that as my guide so that I could talk with those local legislators, who are helping to develop, new new things to be working on, during session this year. So anyway, it was a great experience.
So to Denise's point, if you don't show up, other industries will fill that void. And ultimately, these meetings shape legislative priorities for those individual lawmakers, funding allocations, so requesting appropriations through the budget. And ultimately, they'll shape policies that sustain or destabilize home care. So things like going back to the ACA quarterly report that went in place, if there's issues with fraud and abuse or background screening, whenever, if it's a homemaker companion or a care.com or one of the, gray market kind of registries that are not actually registries are allegedly doing background screening. And then whenever they are ended up stealing from a client and it's on the news, we're the ones who take the hit. And so when they hear home care, whether, if we're not out there showing our value and, making that distinction between what home health agencies do versus those types of caregivers, lawmakers will take it upon themselves and step up regulation oversight through legislation. So it is critical that we're in the room and we're making our case. So the high stakes facing the community. So if we don't speak up, decisions will be made without us. Thankfully, we have very solid representation through Continental Strategy, our contract lobby firm in Tallahassee, and we closely monitor all legislation that's introduced that has anything to do with home care well in advance of the session beginning. So we're on top of that, but we'd like to hear these conversations and also influence those conversations and decisions as to, what legislation will be introduced, whether something will be tossed out because it's actually not necessary, and so on. But the three areas that we are focused on that will be provided to you in a fact sheet that you can bring to to your local county delegation meeting and leave behind with all of the lawmakers in attendance. First being Medicaid reimbursement rates among the lowest in the nation. If you are a Medicaid provider, that is no surprise to you. So we'll outline that on the fact sheet, as well as managed care red tape, Medicaid managed care, delaying care and cutting authorized hours. And then the workforce shortage crisis. We are 50th in the nation in home health aid availability and have been every year since 2016. So just to dive in a little bit more, I won't go too much into detail. I think everyone on this call probably is well aware of this. So right now on Medicaid reimbursement, agencies can't cover the true cost of care. The personal care services reimbursement rate for the fee-for-service reimbursement rate is around $17 and 30 something cents, I believe. We're going to be at $15 an hour minimum wage next year, and Medicaid providers are pretty much there already, being that that was put in place through the budget a couple years back. So we're going to have to increase those rates, where the managed care plans are going to have to get more money from the state in order to be able to cover that cost of care. Otherwise, these Medicaid recipients are going to another setting that's going to cost more or go without and then end up in the hospital. So these low rates are forcing providers to make impossible choices. A lot of providers have decided what services they will be providing through Medicaid, and they aren't actually doing that long-term care because of the low reimbursement, and that is those access issues. Like I said, we know what's going to happen to those vulnerable recipients. Patients left in vulnerable situations. And so the message for lawmakers, we have to increase rates to protect access to care. On the managed care red tape, so endless paperwork, prior authorizations, denials, authorized hours are cut without medical justification. That's happening right now. Sometimes it is with justification, but sometimes it is not. And there's not a lot of, you really don't have an opportunity to fight back on that, the families included. So providers are spending more time on administration instead of patient care. Overall, this is a major problem. So we need to reduce the red tape, hold the MCOs accountable, and streamline the process from plan across all of the plans so that it is less burdensome for the providers and does not delay care for the patients. And on workforce crisis in direct care. So like I said, since 2016, we are dead last in the nation for home health aid supply per 1,000 seniors. I think that national average is like high 20s. Ours is, we are, what is it? No, we're at 16 per 1,000 seniors. The average, so the national average is like 42. All of that will be on the fact sheet though, so you can speak a little bit to some of the data. Turnover in home care has soared. Nearly 8 in 10 workers leave within a year. Providers are turning away patients. Families are forced into unpaid caregiving roles. So there is an economic impact to our state. And the message for lawmakers is support investments that grow and sustain the workforce. Too often we're talking about programs at the state level that are going to increase the number of physicians and nurses and dentists, but we don't talk about these frontline direct care workers who are critical, considering 10,000 seniors turn 65 every day through the end of the decade. And we're a fastly growing state. So all of that will be explained on the fact sheet. So I've already gone through the real world impacts here. And so every story told to lawmakers, though, it's so important to note that it makes these challenges real, it makes them local, and it makes them harder to ignore. So that personal local story is key. And also because you represent the patients, their constituents who they serve in the legislature, as well as providers and the communities, it's key that they hear from you because you are boots on the ground. Your staff knows exactly what's happening in the field. So this is our opportunity to relay that, as well as at the home care day at the Capitol. But this is a real opportunity to cut through a lot of the noise. If you've been to Tallahassee, I encourage you to come with us because it's a lot of fun. It's pretty frenetic and fast paced, and you only get a few minutes, which you only get a few minutes here too, but there's not going to be as many people clogging their schedule. It's a one-stop shop. They're all in the same room. These meetings are several hours in larger counties in particular. So it is an opportunity to convey that and leave something behind that they can take back to their office and think about and follow up with us in order to find out some of the solutions that we recommend for addressing some of these issues. So sharing your experiences among the most effective advocacy tools we have, and this is that opportunity. So how to best prepare. Reviewing local issues and patient provider stories, focusing on those specific challenges, the ones that we outlined, we would like for you to convey if you're not a Medicaid provider. Certainly workforce is affecting you, but also any other issues that are state level, something with licensure or background screening or Alzheimer's training. There's so many different things, so many different regulations that you're subject to. This is the opportunity to bring those up. Offer solutions when possible to those, any issue you do bring up. Like I said, you only will have a couple minutes, so be sure to prepare your remarks to be between 2 and 3 minutes when you go up. They may ask you a couple questions, but I would say generally it's probably not going to go past 5 minutes for your opportunity. And that also will depend on how well attended these delegation meetings are. Coordinating with HCAF for talking points and support. So we are preparing it's a front and back fact sheet that will outline some of the details of those 3 areas I mentioned, as well as provide some economic data that shows just how critical our sector is to the state based on the size of our workforce and the volume of the need from Medicare, from Medicaid, from the VA, from private pay across the board. And check meeting notices in advance as advance registration and deadlines may apply. And I'll talk a little bit more about that here. So that QR code on this slide, as well as the link at the bottom of it, will take you to our web page where you'll find all of the meetings. We're adding them because they're constantly being added on a daily basis right now. These will take place throughout the rest of the year. Some counties even have multiple. I know Palm Beach County and Broward, and they're huge counties. They have, I think, like 3 or 4 because they want to get every part of the county. As I mentioned, some of these meetings do require advanced registration. So there's going to be like a speaker request form, maybe something as simple as a Google form that you'll have to submit by a deadline in some cases. But other than that, it's pretty seamless and easy for you to be able to sign up and be confirmed to be able to speak at these meetings at your local legislative delegation meeting. And also to bring copies of that issue brief, that one pager highlighting the challenges and anything else you'd like to bring. You can bring any kind of marketing collateral you have from your agency, invite them on a home visit. All of those things are very much worthwhile. But I'll just go and show you our webpage right now. If you were to click on or go to that link, or if you were to scan the QR code, just some background on what we're doing here. There'll also be the link to the document somewhere up here whenever it's ready. Should be probably by the end of the day. But as you can see, starting tomorrow in Franklin County, so you'll have the time, the location, and if you're going to speak, you will present, and sometimes there'll be a link like for this one here in Lake County. Otherwise, there'll be a card on site. Franklin County is a pretty small county, so they don't really think they anticipate a lot of people showing up. But each of the county listings will have the time. As you can see, Lake County has several hours they'll be meeting. The time, the location, instructions for registering to speak if that's required, and then who you can contact if you have any questions or if you need to, for instance, one of these links will be I know is a Word document, and then when it says contact on here, that's who you'll email it to. But there are several, and
Kyle, our screen didn't change.
it did not?
No.
Okay, sorry about that, people. Let me share. Where are we? 1 second. That's not it. I blame me because I have about 40 windows open right now. Okay. Here we go. Sorry about that. Do you see this now?
There you go.
Okay, sorry. So this page is where you'll be directed to, and it will have the file that you can just download the fact sheet and print enough out for your meeting. But the upcoming meeting schedule.
Kyle, that didn't. Sorry, it took you to HCAP in the news.
Oh boy.
I'm sorry, y'all. Hang on.
You're okay. Let's see here. Does this share? This should do it. This better do it. Okay. Do you see state lawmakers launch county delegation meetings?
There you go.
Okay.
Thank you so much.
this is where you'll have the link to the file. And these are the upcoming meetings as soon as tomorrow in Franklin County and the Panhandle. So each of them will list the time, the location, and then to speak, the details if you need to fill out something online like a Google form or a Jot form. Those are seem to be the most popular. Some of them have just a Word document, and then it'll tell you who to send it to, either on that document, or if I know it's a Word document, I'll give you the email address under the contact. But as I mentioned, some of these meetings are extra long. Some of them are just a couple hours, and these are constantly being added. I have several more, but this goes through the end of September right now. As you can see, so looking at Clay County and Northeast Florida, complete the speaker request form. That is a Word document. Submit that to Tammy Still by 12 o'clock on September 25th. So if you are in your service area, if you have 4 counties, we will send out reminders throughout the fall just for you to go on and check it, as well as a listing of these meetings. So in case there's one in your community, you can hopefully have that in time to submit the request to speak and get everything prepared. But that is it in a nutshell as far as what the page is going to consist of. We don't want to make it too complicated, and the fact sheet will have all the details for you in a very concise, spelled out way, but it's going to also have the citations, the sources of everything. So if they ask, according to who are we 50th in the nation, and it will be, well, that's the AARP. So we'll have all of that handy for you that you can reference, whether it's in those meetings or if a follow-up meeting occurs with that lawmaker, one of the lawmakers outside of the delegation meeting. You should have enough information to be prepared. And we are here every step of the way to help coordinate home visits, in-person meetings, or get you additional information should you need it.
And
And
really, if you don't feel comfortable going to a meeting by yourself, if you'd reach out, I'd be happy, as long as I'm not attending another one, to go with you if that is, something that you're interested in, and just having an ally along the way. And I did see Jennifer said, do we have a social media template that might be able to be used? So we can work on that to see if we can gather some other home care providers to come to their local legislative meeting.
yeah, and if you would like a template as well to reach out to your lawmakers that are part of that delegation before or after, I can certainly prepare something for that too.
Any questions?
Denise, I had a question. If I wanted, is there maybe somewhere we would see where others are going to attend a certain one from our board because I may possibly want to watch you do one before I do one and go to one of yours or.
Well, I might have, is this Teresa?
Yes, sorry.
No, it's all right. I'm going to come over to Orange County, so I can let you know. I didn't see Orange on the list yet. I didn't see it scheduled, but I wanted to come over anyway. I feel like it's a big area. We've got some issues that I wanted to bring up, so
Okay.
I'd be
That'd
happy
be great.
to attend them.
Okay.
Yeah,
And
I'm
then
not.
Seminole County is another growing area for us as well.
Okay. Yeah, I know that some of these meetings have been broadcast on the Florida channel, which you can watch online live. I'll see if there are any of those that will be aired on there, so you can also just kind of get a feel for it. But yeah, thank you for that. And I know right now they already have meetings scheduled, I believe, through the end of October, and they're adding some that are taking place in September or in October, even if we're moving into November and on to the end of the year. So we will continue to add those as we see them pop in, and I'll make sure that it's fully up to date by the end of this week, as well as with that one pager. We'll send out this recording too with all of the information so you can take it back to your team and encourage others, whether you have multiple licenses in different regions, to go make our case.
Is it appropriate for me to go to the Collier County meeting and discuss the subject, which is my favorite one at this point, the nurse registries?
Absolutely. Are you in, well, if you're in Collier County or if you serve Collier County, yes, it's certainly relevant. You don't have to live in the county. Just be sure to reference that, whether if you are a resident of the county or if you are, you serve, that's in your service area for your business, just to localize it. But absolutely, it is, that's an opportunity to do that.
Yes, I live and serve that community.
Yeah, yeah.
Yep.
Great opportunity to bring that type of issue to them.
Okay. I didn't hear it directly mentioned, so I just wanted to clarify.
Yeah.
Thank you.
We have some topics on our nurse registry issues to discuss with ACA leadership when we have our quarterly meetings when they resume, which will be sometime in late October. So we will be talking to them about some ways to tighten that model up, whether we do it through legislation or regulation. So that's certainly on our radar. We want to define the biggest areas, Medicaid reimbursement, long outdated, of course, and then managed care. It is not only growing on Medicaid side, or it is the name of the game in Medicaid, but obviously growing on the Medicare side as well. And then workforce is, prolific and impacting every provider.
Understood. I mean, those are all financial issues, but if you have one business model that is going to eliminate another business model, that's a problem eventually with service as well.
Certainly.
Yeah.
Absolutely.
Mm-hmm.
Especially if consumers are not aware of the difference.
They're not, and that's what my bone of contention has been, and I've discussed with Denise. I feel that the current law should be placed more front and center so that the consumer can actually get the warning that the law was intended to provide.
Mm-hmm. Yeah. Yeah. Eric, it's a great place to voice that. Mm-hmm.
Okay, then I got September 15th. I'll be there.
Perfect. And if you need, and just to that point, if you need help looking up, the number of nurse registries in that county compared to the number of home health agencies, just to kind of quantify that there is a growing number of nurse registries, which they are growing statewide. And without that lack of, clarity for the consumer, there are some issues that do happen. Just like with homemaker companions, they don't understand what the difference between the three of our provider types are. And there's about 6,000 between homemaker companion, nurse registries, and home health agencies. There needs to be a clear understanding of what, the links that home health agencies are required to go to, and what protections come with that.
Well, yeah, if you have some statistics that could show me that would be very helpful. People like numbers. I can quote the law and talk about how it's impacting me, but if you have some statistics that could back it up to show the growth, that would be helpful.
Certainly. Well, we are right at 12:30 unless there are any other questions. Like I said, though, we will be sending out this recording as well as the fact sheet and the links to the link to the website. But if you have any challenges, either connecting with the local delegation office to be able to get on the agenda to speak, or accessing the form if a link goes bad or anything, please feel free to reach out at any time. My contact information is here, but Denise, Jessica, the team, we can help you. Any of us can help you with this. We'd be happy to. And as Denise mentioned, if you'd like someone to tag along with you, if we are available, we would be happy to, or perhaps a board member in the region could do so.
Kyle, I have one more question. I'm sorry to interrupt.
No.
Where exactly, and I'm sorry, I couldn't see when you posted, where exactly on the website can you see those meetings?
So if you
It's under what resources?
It'll be it's on the news page, and it's going to be featured, so it'll stay at the top of the news page, but it's also, if you just scan the QR code on this slide or go to under resources or under about, it's also under for members, just go to Media Center and then click on news, and it's the top.
Okay. Okay, thank you so much.
You're welcome. Thank you.
Well, I look forward to seeing your faces at the nearest one to you. I'm going to try to make as many as I can and drag Kyle along on our road trip. But we look forward to it. We really appreciate you joining today.
Thank you.
Denise, the weather's really good in Collier County, predicted to be clear and sunny on the 15th of September.
I am hoping it's gonna be, honestly.
Okay,
All right.
thank you.
Thanks, guys.
Thank you, everybody. Have a great day.